So questions have been raised in the UK Parliament about British involvement in the war in Yemen. The opposition Labour Party has demanded answers after media reports that British special forces had been involved in gun battles with Yemen's Houthi rebels. The party's representative on Foreign Affairs, Emily Thornberry, also pressed the government over allegations that British forces may have provided support for child soldiers as part of the Saudi-UAE coalition.
There is one especially disturbing allegation in the Mail on Sunday's report, which was that our forces are providing support to locally recruited Saudi-funded militia, where many of the fighters, up to 40% it was alleged, are children as young as 13 years old. So I would ask the Minister of State if that is in any way true, because if it is, then it would confirm that our forces are not just a party to this conflict, but witnesses to war crimes.
I'm keen that we get to the bottom of those allegations. Again, I'm very keen also not to in any way mislead the House, but the allegations that were made in relation to any engagement that involves bringing child soldiers on board would be, I think, would be appalling.
Charlie Angela's following this one for us from London. Charlie, can you give us any more background on this? I mean, the story just sort of seems to have come out of nowhere.
Sure. Well, actually, just after that quote you heard from the Foreign Minister, Mark Field, who's actually only been in his job for a day, he went on to say that the government's going to urgently investigate these allegations, which is quite unusual because government policy is not to comment on any special forces operations. But the source of these allegations is the Mail on Sunday newspaper, which alleges that elite Special Boat Service troops, the SBS, are present in Yemen and 5 were injured in gun battles in Sadr. And if true, that would wholly contradict the British position that this government is not participating in the conflict, only providing logistical support to the Saudis in Riyadh. Back in February, there were reports on social media that British soldiers had been injured in firefights during a humanitarian operation in Yemen. But what the Mail on Sunday is claiming is that these SBS soldiers were not just involved in humanitarian operations, but actually providing mentoring in Yemen. That's medics, translators, and forward air support, whose job is to request air support from the Saudis. Now, in the article, the SBS source says, and I quote, "The SBS's role is mainly training and mentoring, but on occasions they found themselves in firefights and some British troops have been shot. Obviously, nothing about the mission will be confirmed publicly by the Ministry of Defence unless a UK soldier is killed." Well, you heard the opposition Foreign Minister, Emily Thornberry, there saying that time and time again, Britain has said that it is not party to the conflict in Yemen. And that phrase has been used to explain why it cannot assess any individual violations of humanitarian law. But if these allegations of boots on the ground prove true, it will completely undermine the official position that Britain has, which is that there is no military solution to this conflict, only a political one.
And yet, I believe the word you used were general logistical support is what the British say they have been providing to the Saudis. I mean, that does constitute sort of some sort of involvement, I guess. What does logistical support really mean?
Well, as we know, the UK supplies billions in dollars worth of arms to the Saudis, so that could be assessed as explaining how these arms operate. But you're absolutely right to pick up on that phrase. We're saying we are not, Britain is saying it is not party to the conflict, but it has a supportive role. And that is now what ministers want to unpick. What does this supportive role actually involve? There was also allegations in that Mail on Sunday article that 2 Royal Air Force servicemen were injured in Saudi by a Houthi drone. And if that also proves true, then there will be questions as to why RAF servicemen were on the runway in Saudi when they should be behind the desk offering logistical support only.
Very interesting. Thank you. Charlie Angela in London for us there. Well, earlier on Wednesday, 7 people, including 4 children, were killed in an airstrike on a hospital in Yemen. The charity Save the Children says its staff were on the ground supporting the medical team at the time near the city of Sadr. Well, years of conflict have wrecked Yemen's healthcare system. More than half the hospitals and clinics have been destroyed, and there's also a shortage of medicines. And those that are available, they're too expensive for most Yemenis. Priyanka Gupta has more on this.
Yemenis can't afford to be sick. Habib Hazza doesn't work because of his injured spine. On top of that, he had to sell the family home to buy medicine for his father and his brother. As his brother's condition worsens, the medical bills are piling up. Their rented house in the capital Sana'a doesn't have much. The only thing for Habib to sell is the television. $10 isn't enough to buy medicine.
My brother is in very bad health. Sometimes he goes into a coma and sometimes he vomits blood to the extent that I am ready to sell all or part of my body to save him.
Even when Yemenis have money to spend, there are not enough medicines to buy. Abdul Wahab Muhammad has been queuing for hours to get treatment for his diabetic wife. But as on many days since the war began, Abdul again returns home with half of what his wife needs.
My wife also needs medication for high blood pressure, but I didn't find it here. So I will have to buy it from a pharmacy, where it's almost 3 times more expensive.
The plight of Yemen's almost 35,000 cancer patients is especially acute. Sana'a's main cancer hospital receives more than 600 cases a month. Doctors are facing a severe shortage of drugs. The war has destroyed more than half of Yemen's hospitals and clinics. The journey to the ones that remain open is often long and expensive for patients. Aid workers say many are dying at home without treatment.
I've just come back from Yemen, and what we've seen is that many dialysis patients have been limited to only one treatment a week, and that puts them at much greater risk of additional diseases and certainly death. Certainly people with cancer as well. We're very, very concerned about this situation. There are over 30,000, 35,000 people with cancer across the board, many of them with treatable cancers that in normal circumstances we should be able to cure.
In cities such as Thais, the cost of water has soared. Wells have dried up and supplies are restricted because of fighting. Some Yemenis are forced to drink dirty water. Health workers say the number of cholera cases has risen in Thais and 7 other provinces since the beginning of the year. Since then, close to 170 Yemenis are reported to have died. And with the rainy season due to begin in a few weeks, it's feared the cholera crisis will become even worse. Priyanka Gupta, Al Jazeera.
To other news, and opposition groups in Algeria say a call by the military